Greetings from Delft University of Technology. Welcome to our first feedback session of this MOOC. My name is Arman Al-Bayrak. I'm an assistant professor here at the Faculty of Industrial Design Engineering and my expertise is in human-centered design and research in healthcare.
My name is Marijke Melles. I'm an associate professor here at the Department of Human-Centered Design. And my research expertise is also in human-centered design, human-centered research for quality of care and in healthcare in general, in particular communication and patient experience and patient engagement in healthcare. So welcome to this first feedback session of this MOOC. In these feedback sessions each week we will pick a few examples and discuss them together for you to learn from the examples of others. And this week we picked 4 different examples from different medical cases, and we will discuss them briefly with you. So in this first module you were asked to choose a case and then identify the actors, the human actors and the non-human actors, and also map the interactions between the actors. So this first example, this participant chose for the case of patients with gout, and the actors that were identified, the human actors first. Well, the main actor, of course, is the patient with gout. The human actors that were identified were patient themselves, doctors, patient's family, and patient employer. So we choose for the patient who's still at work. The non-human actors that were chosen are medication, productivity, work-related, disease burden, and disease damage. In this case, except for medication, the other ones, productivity, disease burden, and disease damage, are more phenomena, and not the human actors as actors influence the journey of the patient. So, and you see it also in the interaction map. So it's well done with different human actors, and indeed experiencing this disease leads to certain phenomena like productivity, quality of life, social activities. But what we are looking for are non-human actors like the built environment or the mental environment or the social environment that influences a patient. So like buildings, equipment, tools, internet web pages. So built environment and social environment.
The second example that we have selected is about osteoarthritis, and in this case the participant has identified the non-human actors very well, because if you look, the differentiation was made by the waiting rooms, but she or he elaborated a little bit more on what we understand in the waiting room, like the ambient conditions, chairs, magazine, equipment used for drawing blood, for example. Also further elaborate on the needle, the tube, and the medical equipment, for example, X-ray and MRI machines. So I think this is quite nice example how you can elaborate more on the non-human actors and see how these are different products and services are used within your case. And also this representation, what I like very much is that you can see easily a very nice overview and see easily what the human actors and non-human actors are because of the coloring that she or he has used. The only feedback maybe I can give on this is the focus is very much on the hospital. So if you do an actor map, also look broader than only the hospital as an organization.
Yeah, and I have another example here, also of a map, different actors and human actors and non-human actors of a case on osteoarthritis. But you see here, it's visually very attractive, different colors for the human actors and non-human actors, but also icons are used. One thing that you could add in an interaction map like these is maybe also titles of the different sorts and types of interactions between the different actors. It gives even a better insight of how the system is organized. Also for this example, the focus is mainly on the hospital, so also here you can the participant could look a bit further also outside the hospital, think about work, work-related actors, maybe sport or hobbies or home-related actors. So that could still be a bit more elaborated because that also influences the patient journey a lot. One more example that we would like to share here is this one. And what is nice about this example is that so in the middle it's again the case hand osteoarthritis. So in the middle is the patient, and the different actor groups, you could say, are mentioned here. So it's not only hospital, like here, healthcare providers, but it's also about education, caregivers at home, employer, work-related, health insurer, medical equipment suppliers, and pharmacists. So the whole system is really viewed from a very broad perspective. And what I like about this one is that for each group, it is described how this group influences the patient or how it interacts with the patient. And that's, of course, also something that you will do in the coming weeks. For the healthcare providers, it's further detailed in the different healthcare providers and also the different pieces of equipment and rooms that are used. This could also be done for the other groups, of course, to get a more complete picture of the whole context.
Yeah, well, one final example, and we just want to show you is this one. And yeah, we like this example very much because it shows really the complexity, right? So if you only by looking to these arrows and how these connected to the actors, it shows really the complexity, and also I think it shows very well the creativity of this participant. So also in the coming assignments, you can be creative and also use drawings or use your own way of making your representation. So
thank you for all your work. It's really great to go through all the examples and all the assignments that you uploaded. Looking forward to next week in Module 2. See you then.
See you next week.